You're listening to Health and Image, where we interview top doctors and experts on procedures and topics you want. Hello and welcome. You're listening to Houston High. I'm your host, Stephanie, and today we are talking about functional medicine. We are going to learn more about it, and I'm actually talking with Dr. Julia Ward, and this is her specialty, so she is going to answer our questions. Dr. Ward, welcome to the show. How are you?
I'm good, thank you.
So let's just start out with, what is functional medicine for those out there who don't know?
So functional medicine is sort of a holistic way of looking at things. Rather than the traditional model of diagnosing what's your condition and then giving you a prescription to treat that condition, it's more of looking at the root cause of why do you have that condition in the first place. So let's take, for example, high blood sugar. Instead of saying, oh, your blood sugar's high, here's your diagnosis. You either have diabetes or maybe it's pre-diabetes, and here's a prescription that's going to lower your blood sugar. Functional medicine takes the approach of, why are you having your blood sugar high? That's not normally something that should happen. So let's look into some of the reasons why. Is it the food choices that you're making? Is it, the lack of exercise? Is it, it's various different things.
Yeah.
But a lot of it does focus on lifestyle and choices that we make.
Yeah.
So it's kind of treating the root cause rather than just the symptoms.
Yeah, I love that. So I would say that's definitely why we need functional medicine in our lives. So what are some of the services that you offer at your practice? Like say someone does find out that they have high blood pressure, for example, just because you just used that, and they come in, how can you help a patient?
So we do a kind of a comprehensive overall view of somebody's health, and we look at various different things, not only traditional lab work, but what we call some functional labs that look beyond what the traditional medicine is looking at. We also do complete body analysis using a bioimpedance scale. And then we have programs that will kind of help guide people to get to where they want to be in their health goals, and that usually involves a detox program of various lengths of time. And when I say detox, I don't mean like a juice cleanse or some crazy diet that has you going to the bathroom every 5 minutes.
Yeah.
But it's more of a program that has you adding in some vegan-based shakes and using some very specific supplements to add to your diet. And then mainly focusing on the clean, whole, unprocessed foods. So that's where we start. And then that can include hormone balance. We definitely look at thyroid in all of this. Sometimes we'll offer IV nutritional therapy for people that need that little bit of extra nutrition that they're just not absorbing real well from the stomach. And we look at, gut health, because that really influences a lot of your health, is how healthy is your GI system.
Right. So what are some of the reasons that a patient might consider, coming in to see you, besides just like the example that we gave? I mean, what do you see a lot of?
So I see a lot of people who say, I'm feeling tired, worn out, and I've been to my regular doctor and they say that everything's normal.
Yeah.
And I know something's not right because I just don't feel right. Besides the traditional, or some of the more traditional patients I take are like if they're having menopausal symptoms, hot flashes, night sweats, foggy thinking, they can't remember things. That's another thing too. And then also just to touch on the sort of brain health too, we do focus a lot on that as well. And I have a very specific brain function test that people can take, and it looks very specifically at about 8 different aspects of your cognitive function, or how well your brain is working. And so from that, we can make recommendations. So that also is really important, because, a lot of people, and myself included, are worried about declining mental health, as far as remembering things. We see all kinds of memory centers popping up everywhere for people. And then it seems like most of my friends have had parents that they've had to deal with as far as getting them into assisted living or some kind of situation because they can't remember things to deal with everyday life.
Yeah, definitely.
And so that's a big concern for a lot of people.
Yeah. So what are some of the benefits that you would say just of, looking for the root cause and how you can treat it versus, like you said, with conventional medicine, just kind of treating the symptoms? How do you feel like that helps the patient so much more?
Well, it's like what I tell people, it's like the check engine light in your car.
Mm-hmm.
You can stick a piece of duct tape over that so you don't see the check engine light.
Yeah.
But if you're not actually fixing the problem,
right,
eventually things are going to go downhill, right?
Mm-hmm.
Your car's going to break.
It's going to get worse.
And so functional medicine exactly is like, well, why is that check engine light on?
Mm-hmm.
We need to fix that problem rather than just taking a medicine that's going to switch the light off for a little bit. Because you notice there's most of these medicines that traditional medicine prescribes are kind of forever deals, right?
Right.
It's not like, oh, here's a high blood pressure medicine and you should only need this for a couple of months and then you'll be fixed. It's like, no, you've got to take it every day for the rest of your life.
Right, yeah.
Same with cholesterol medicine or blood sugar lowering medicine, things like that.
Wow.
So it's really getting to, because my ideal for people is to get them healthy so that they're not dependent on any doctor or any prescription medication, that you just get back to a more natural state.
Yeah, so you can actually help a patient who is taking blood pressure medicine every single day to where they don't have to do that anymore?
Correct. Yeah.
Wow. That's definitely amazing. So tell me, what made you want to get into this specialty and really focus on functional medicine?
Initially, it was just my own desire to look into bioidentical hormones for myself. And when I asked my GYN doctor about them, it was clear from her answer that she didn't really know that much about them.
Right.
So when I started researching bioidentical hormones, like what are they and why would I want to be on them? What's the difference between that and regular hormone therapy? Mm-hmm. I found that's when I stumbled onto this world of functional medicine. And I learned that bioidentical hormones is just a small part of functional medicine overall. And it just made so much more sense to me.
Right.
Looking for the root cause and treating that instead of just chasing symptoms.
Right.
So that's kind of how I got into it, was looking at bioidentical hormones.
Well, I'd like to thank Dr. Ward for coming on today. If you have questions for Dr. Ward, be sure to reach out to her office. They would be happy to help you, or you can also ask a question right on the showcase page. You can also check out the ebook on functional medicine as well. Until next time, thank you for listening.